So good evening and welcome everyone. We are going to get started and it is my pleasure to introduce to you the Dean of the School of Nursing and Health Professions, Margaret Baker, who has joined us to give us a welcoming words. Dean Baker?
Thank you, Carolina. Good evening, everyone, and welcome. And I'm always very excited to be invited. The students are so inclusive and welcoming, especially the GNA leaders. And so very happy to be here tonight and welcoming also our friends from oncology nursing and oncology nursing certification. And just wanted to congratulate you all on a long academic year. We're all there. And even though there's probably more to go for many of you, I think it's really a tribute that we're at this point and that you're still engaging in opportunities to network, to educate each other, and to explore opportunities in your careers. And so unfortunately, I can't stay this evening. I'm due at another function in a little bit. But I really wanted to say some welcoming words and wish you all the best of luck. Thank you.
Thank you, Dean Baker. And now it's my pleasure. I would like for the different partners to introduce themselves. We have the GNA and we have the ONS teams. So Heather, would you like to introduce the GNA?
Thank you very much. I'm Heather Battaglia. I'm the president of GNA, and I'm so happy that you could join us today. I have Michaela Castro here. I'll let Michaela introduce herself.
Hi, everyone. My name is Michaela. I'm the current events coordinator for GNA, so I take care of things like if you went to the spring symposium, and also I'll also be heading the fall symposium, and I've been working with Heather and Carolina and Patrick to put together these events for you guys with ONS. And then I just want to pass the baton along to Patrick, by the way.
Thanks, Michaela. I appreciate it. Hello, everybody. Good evening. My name is Patrick Flynn, and I'm the Student Engagement Manager at the Oncology Nursing Society. So those of you that have been in some of our meetings, the last couple that we've had, you've heard me speak before. So tonight, I'm just here to, have the honor and privilege to introduce some of the people that are going to be speaking to you this evening in regards to certification. So I'd like to first introduce Clara Beaver, and Clara has been an oncology nurse for over 20 years. She is currently the clinical nurse specialist at Karmanos Cancer Center, where she works with both inpatient and outpatient nursing, as well as community sites. Clara has also been the chemotherapy expert at KCC for 15 years. And continues to work with ONS and other organizations to provide education and safe practices for patient and staff. In 2019, Clara joined the Oncology Nursing Certification Corporation Board of Directors. And then I'm also honored to introduce Tony Ellis. And Tony is the Executive Director of the Oncology Nursing Certification Corporation. He joined the team in 2019 and serves on the executive leadership team of the Oncology Nursing Society. Previously, Tony worked for the National Association of College Stores, ultimately serving as the Vice President of Association Services responsible for professional development, meetings and exhibitions, certification, membership, volunteer management, and advertising sponsorship sales. He has more than 27 years of experience in training, coaching, and association management. So I'm going to mute. It's up to you, Tony and Clara. Thank you.
Thanks, Patrick. Thanks, everyone, for inviting us. Like Patrick said, my name is Clara Beaver. And part of the reason they asked me to talk to you guys today is I am doubly certified. I have a AOCNS certification from ONCC, and I have an ACNS-BC certification from ANCC. So I've been through where you guys are. I know what's going on. So hopefully today we can answer some of your questions about certification. And I am a clinical nurse specialist in oncology. So if you guys have any questions about that, I'm here as well. But I'm going to hand it over to Tony, and he's going to get us started.
Great. Thanks, Clara. Hi, everyone. And I'm happy to be here. Thanks for having me. I'm here to answer some of the technical questions around certification, but I'm not going to get too far into the weeds. But there's a little bit I think we should level set with before we get started, or to get started. And then the tough questions about getting certified, I'm going to leave to Clara in the second half of the presentation. So let me go ahead and screen share and I'll get the slides going. And everyone should be able to see those now. So the first thing that we thought would be helpful to do would be to cover some of the terms that are associated with certification, because you probably will hear credentials, certification, and certificates, especially those three terms, used somewhat interchangeably, and they do mean different things. And so as you start to do your homework and thinking about where you need to go next with certification, it's important to understand the difference between the three. So for credentials, that term is really an overarching term that refers to many different types of recognition. It could be a registration, your licensure, it could be a certification, it could be anything from your driver's license to any other type of credential or documentation that shows that you have accomplished some set of tasks or meet certain criteria. The other two terms that are subsets or types of credential that you're going to hear often and sometimes confused or used interchangeably are certification and certificates, and they are different. Certificates are typically awarded at the end of a single educational event or after the accomplishment of a small skills. Nurses, it might be taking a training course and demonstrating you can start an IV, for example. If it's just for participation that you showed up to the program, it might be a certificate of completion. If there is an assessment of the knowledge that you gained in the program, it might be an assessment-based certificate program. But those are both types of certificates. Certification, on the other hand, is much more broad and comprehensive, and it covers the full, what we call the body of knowledge for a role or a professional position. It typically permits the person that earns the certification to use a licensed credential or letters behind their name, such as RN or OCN. And in some cases, the certification might be required for licensure. When you talk about certifications, it is a higher level of achievement, and it's intended to recognize specialized knowledge and experience in education. It's really built on what we call the 4 E's: education, experience, ethics, and exam. In most cases, most certifications, especially in nursing, are based on a knowledge exam that will test your understanding of concepts as well as your application of concepts. But it doesn't necessarily test your ability to actually do the task, right? And so the first 3 E's help achieve and kind of round out your what you need to earn the certification. The education component typically is a requirement of certain academic preparation, like you're probably doing right now, or some set of continuing education. It might also be certain academic topics that you need to cover. The experience is typically a certain number of hours performing the work in the specific area that you want to be certified. That helps to make sure that you have time on task actually doing the tasks. And then most programs, if not all, especially in healthcare, have some type of code of ethics or a code of conduct. And that just helps to ensure that those that are certified maintain a certain level of practice, and it helps to safeguard the public by making this certified individuals live up to that code of ethics. Those 3 things are usually coupled with a knowledge and application exam in order to earn the certification. The education, experience, and ethics are typically prerequisites, or what we call eligibility criteria, to become a candidate for the exam. So if you can show in your application that you meet those 3 sets of eligibility criteria, you become a candidate and you can sit for the exam. If you pass the exam, then you can earn the credential or certification. I think it's important to know, you won't see it as much in nursing, but you might run across it, that the exams, you may have multiple exams you have to take in order to earn a credential. It may require demonstration of activities, a performance component. It may include an oral presentation or even the submission of a portfolio of work. It depends on which type of certification you are going for. One of the other primary distinctions between certification and certificates is that certification requires maintenance. That is, you have to renew your certification. And what that means is every 3, 4, 5 years, you will have to turn in documentation showing that you have continued to work in the practice is a typical requirement, that you've earned additional education or continuing education in certain topics, or at least within the body of knowledge for that credential. In some cases, you might have to retest. Retesting is an option to renew for the ONCC credentials. It's not a required method of renewal. Most people choose not to renew by taking the test again with us. The other thing that I wanted to mention is that similar to individuals getting certified, organizations and programs get accredited. So high performing, high quality certification programs that meet the standards set by independent agencies can become accredited. And the ONCC programs are accredited by the National Commission for Certifying Agencies. There's also an organization associated with the American Board of Nursing Specialties, and we'll give you their website in a little bit, that accredits certification programs. So both of those are good resources to look at to see the different types of certifications that are out there. But let's start with why you need certifications. So if you can use the reactions in Zoom and give a thumbs up or raise your hand, how many of you are currently practicing as a nurse? I can only see so many video feeds. Let me see if I can see more. No, you're just doing school. Okay, I don't blame you. I did the same thing when I was in grad school. It's a good choice. Well, so how about this? In the chat, can you, what are your plans for after you get your graduate degree? What do you hope to do next? Where are you going? Can you read the chat for me, Clara?
Yes. Someone, Michaela wants to go into critical care. Heather wants to go into palliative care. Ananda Lee wants palliative, then hospice, oncology based. That's all good. Or possible geriatrics NP.
Good. So you all have a direction that you're headed. And that's—
Tracy's open to anything.
Oh, very good. Keeping your options open. All right. That's smart. Well, that leads into why you need certification, to be real honest, because certification is one of the next steps after licensure. It is, certification validates your knowledge and your qualification to practice in a specialty area. So each of you, the things that you listed are all specialty areas of nursing that Clara and I know the people who run the certification programs for those areas. And so I'm sure they're going to be watching for your applications to come in. In some cases, certification may be required for your licensure in the specialty. It also, in some states, it can serve for the credit that you need to renew your RN or APRN licensure. So that's something to keep in mind as well. I think more importantly, though, there's value to becoming certified that is worth you knowing right out of the gate when you start to do your research on the different types of certification. This list came from a survey that was done a couple of years ago by the American Board of Nursing Specialties, where they interviewed certified nurses from ONCC and other member organizations of ABNS. And they said that having the certification from their specialty, you know, it proved to themselves and others that they had the specialized knowledge for their area of practice. It made them feel more in line with the standards of their practice than non-certified nurses. And I think the key there and a value to you in the job market and to your employer is that you may have a position in nursing that has a certain set of responsibilities, but it might not have all responsibilities of, you know, the maxed out professional working in that specialty, but you would need to know those things in order to pass the exam for the specialty. And so it would actually make you a more well-rounded nurse, a more knowledgeable nurse and candidate, obviously, as well, to be certified. So that's something to keep in mind, along with people reporting a strong sense of pride and accomplishment, confidence in their ability and their interactions with others on the care team. Another survey that was done by the Institute of Credentialing Excellence that we're also members of, they interviewed more than just nurses, other professions, but they also found increased professional confidence, enhanced confidence in their professional interactions with others, and that it kept them more connected to the profession. And I think that last one, although almost 50% doesn't seem high, but in the year that we've had in the last year and a half, and knowing the kind of work that nurses do is demanding, to know that having the certification for your area specialty helps credential holders have greater job satisfaction, I think is worth knowing, right, going into it. So with that, we start to get to where do we start and how do you start the search? And for that, I'm going to turn it over to Clara because she has all the credentials.
Thanks, Tony. Yeah, so really we're talking about why to be certified and where to start. And, you know, I can tell you when I was a new graduate nurse with my BSN, certification was one of my goals, but how was I going to get there? When would I start? And when I became a graduate, when I went back to school for my graduate degree, I knew I needed certification. I already had OCN, but I knew I needed certification to be an APRN. And I really needed to think about what was I going to do, where was I going to go, and when should I do this? So really being aware of certification, whether it's required or not in the area you're entering, and even if it's not, you really should consider it. So in the state of Michigan, and I believe most states, I'm in Michigan, I don't think Patrick told you that, but I practice in Detroit, Michigan. It is a requirement for me to be an APRN, to be licensed as an APRN, to have a certification. I have two. I don't need two, but I do have two because that's just how important I feel certification is. But every year, every 2 years when I renew my licensure, I have to show that I still have my certifications, my advanced oncology certification, my advanced CNS certification. How do I know which ones to pick? Well, there's a couple of resources here. There's the American Board of Nursing Specialists, and then nursing.org has a complete list of certifications. And Michaela's actually done some research for you guys. She's put together something that she's going to give you that shows all the different certifications, right, Michaela?
Yes.
I can't see you shaking your head, sorry.
Yeah.
So I think she's going to share that with you guys. And, you know, ONCC is always a great place to look for certifications. I really highly recommend that. Michaela, did you want to add anything?
No, I will share my screen after your talk and talk about the different areas.
Okay, perfect.
Thank you.
All right. Next slide, Tony. So when you are thinking about certification, you need to kind of research what the eligibility criteria is and what resources are available from your employer, or other sources. It's helpful. My organization helps pay for certification and renewal of certification. That's a great perk to have. Not all do. But you also need to map out your path to certification. And I know you're still in school and you're thinking, oh, I have all these papers due, I have all these tests to do, but really now is the time to start looking at that. If you're a graduate nurse in graduate school, you're looking to move into that APRN role, really you need to start taking that certification shortly after you finish your coursework, just like the NCLEX. You had to take that after you finished your undergrad degree. You took it almost immediately after. So really now is the time to start looking at that pathway to certification. I can tell you I have multiple students right now, CNS students. One of my CNS students has been talking for 2 years about taking the OCN exam. And so I sat down with her and I said, when are you going to take the OCN exam? And she said, well, I'm going to try to study for a couple weeks and then I'm going to see how it goes. And I'm like, no, that's not what you need to do. You need to set a path to do that. These are some of the things that I think you need to do. And so I really helped her get on that path. So really discuss that desire to become certified with your supervisor, your mentor, your counselor. Those are people that can help you look at certification, look at what's required, and help you along that path and try to figure out how to get there. All right, preparing for certification. That's what you guys all came here for. You want to know what it's like. I've, taken a few certification exams over the years. I took OCN back in the day when it was still paper and pencil because I'm old. I took AOCNS actually when my son turned a year old, and I took the ACNS exam, I think back in 2005, 2006. So I've taken a few certification exams so I can kind of walk you through this. So you want to be certified. Now what do you do? Well, first you need to figure out what certification you want. So again, we talked about there's multiple certifications out there, depending on your specialty, depending on your job. If you're a nurse practitioner, a clinical nurse specialist, a staff nurse, a nurse navigator, whatever your role is, there's actually different certifications out there. The first thing you do is need to review the eligibility for those. Do you need an amount of time in the specialty? I can tell you for OCN, and I only know this off the top of my head because I have a lot of staff going for that, is 2 years or 2,000 hours in oncology, because we want to make sure that they have some knowledge above novice to be able to take the exam. Are there education requirements or a degree required? So for APRN exams, obviously you have to have a master's degree or a DNP to take those exams. A lot of certifications also require some type of continuing education credits within that if it's a specialty. So for OCN, you have to have a certain number, and I don't know that off the top of my head, certain number of oncology-based continuing education credits. But then also look, because there's multiple options for eligibility. Sometimes a certification may have different eligibility if you're a new grad, or different eligibility for APRN versus BSN. So look at that, those options for eligibility. The next thing you're going to want to do is you're going to want to review the test blueprint or test content. And the reason you want to look at that is because that helps you start to know, well, 1, am I really ready to take this? 2, what am I going to need to do to study? But 3, it also gives you an idea of what's on that exam. So I can give you a great example for OCN. I have a lot of inpatient nurses that don't want to take the exam because they don't give chemotherapy. So I look up the test blueprint for them and look at it, and 19% of the exam is based on treatment modalities. Within those treatment modalities, there are 6 different treatment modalities that are tested on. One of those is chemotherapy. So the chances are you're going to have maybe 3, maybe at the most 5 questions on chemotherapy. That's not a lot. So, and I'm going to tell you, if you're looking at what the novice nurse or someone that's been in practice for 2 years knows about that and will be able to take the exam. So it's not that big a deal, right? And that's what most people think. They worry about those little itty bitty pieces. But if I can do it, you can do it. Then you're going to want to review the reference list for the certification. It's a huge list. It's sometimes 10 pages long, which seems like a lot, but those are all the resources that they use to write that exam. And it's a great place to go to if you want to look at something very specific. For example, if there's going to be questions on statistics, you want to know what year they use those statistics from. So OCN uses the American Cancer Society Cancer Facts and Figures, but it's for the year that those people wrote the test on. And those questions are probably written a year or 2 before you're actually taking the exam. So it's important to know that because numbers change, right? Figures change. So it's important to know those things. The other thing is you want to review the process for applying. You need to know what you need when you submit to apply and what the timeline is. So a lot of times you can apply and it may take 6 to 8 weeks for them to approve your application. But then after that, you have another amount of time until you take the exam. Some exams are given throughout the year. Some of them are only given a couple times a year. So it's important to look at that certification and determine when that test is so you know the best time to apply for it. All right, applying. Now, Tony asked me why I put applying before studying, and I really look at applying and studying at the same time. I told you about my student who told me, I'm going to study for 2 weeks and then I'm going to see how I do, and then maybe I'll look at applying. Well, if you do that, that 2 weeks is always going to be next month, a year from now, 2 years from now, and you're never going to apply. So I always look at applying and studying at the same time because I need to know when I apply, how much time I have to study afterwards, right? So I kind of look at the same time. When you're applying, there's a few things that I'm going to tell you because when I first applied for my ACNS exam, I did a couple things wrong and it extended the time that I had to take the exam. And why that's important is they changed the eligibility in amongst there. So I luckily was able to grandfather in because I had to fill out a couple more pieces of paperwork, but they changed the number of hours clinical hours that we needed, and I didn't have from my actual program. So that's why it's important to do these steps. First, you want to access the candidate registration material. It's always on the website of whatever certification you're taking. There's always booklets. If you want it in paper, you can usually call the organization and they can send it to you. ONCC has a lot of them. We send them out quite frequently to people. ANCC has them as well. You can always get them. The next thing you're going to do is you're going to read every single direction before applying. And that, I think, is the most important thing to know because you need to know every single thing that you need to submit because it's not as simple as filling out a piece of paper. There's also other things that you need to submit. The next thing you're going to do is you're going to gather all that information that's needed. You know, if there's education requirements, they're going to want to see, for example, that you have an MSN, they're going to want to see your transcripts. If there's CE requirements due, they're going to want to see those CE certificates. If there's employment eligibility, they're going to want to see that. So you're going to want to make sure you have all that information. The next thing you're going to do is you're going to look for discounts. And I say that because certification exams are expensive. They range anywhere from $200 to $1,000. Most of them run around the $250 to $300 range, but they can run up to $1,000. They are not cheap. And so you want to look for discounts. A lot of times there's discounts around Certified Nurses Day, which is March 19th, or Nurses Month, or if there's conferences around that specialty, there can be discounts as well. Nice Google, you just Google in for discounts and you can look at that. For example, right now, ONCC is running a 20% discount for nurses during Oncology Nurse Month. So again, look at the newsletters that the organization sends out, look on the website, and you'll possibly find those discounts. Discounts are always great, certification is expensive. Then you're going to submit your application and payment. And make sure the payment goes through because that can also delay your acceptance to test. And that actually is a little bit of what happened to me. That something happened with my check and it didn't go through right. And I don't know, I can't remember exactly what happened, but it really delayed everything. The other important thing is when you're filling out the application, make sure you give them a phone number and an email that you check frequently. So if I gave them my work email, but I changed jobs or it went to spam and they asked for additional information, I'm not going to be able to see that. So you may want to give them a personal email that you look at frequently that doesn't throw everything into spam mail, because I can tell you my work email throws everything into spam, which gets difficult at times. So a lot of times I just give my personal email so I make sure I see it. And then the best part is when you get that authorization to test. And that you get that and it's been a long 6 to 8 weeks and you get it and you're so excited, and then you have whatever time frame it is. For ONCC, it's a 90-day test frame. So 90 days from that time I get that authorization to test, I can schedule my test. Now, a couple things that I've learned about scheduling tests. You have 90 days. Do not wait until that 90th day to take your exam. And I say that because things in life happen. Pandemics happen, hopefully never again. But people get sick, family members get sick, things happen, emergencies happen. And if you've scheduled your exam on that very last day, you have no wiggle room of where you can move that exam. So I always recommend to people to schedule about 2 weeks before the end of that if they want to wait that long, because it gives you a little buffer of when you can reschedule that exam. Now, if there's a huge, horrible emergency, most certification agencies will work with you and extend that period for you, but don't count on that. So try not to schedule for that last possible day. And I have seen it happen, and I have seen people lose their money because of that. So that's just one little bit of advice that I can give you. Next thing we're going to talk about is studying. Now, this is the most nerve-wracking part. Did all of you take the NCLEX? And I can't see all of you. Not yet? All right.
Only some of us.
Okay. So I can tell you NCLEX is horrible. I hope I never ever have to take that exam again. And I'm not trying to scare you. It is horrible because your whole life depends on that exam, right? So, but much like the NCLEX, certification is, how do I study for all these possible questions that can happen? So I've been in school for 4 years, 5 years, 3 years, whatever it is, and I've learned all this information. And how do I know what to study? And again, that's where that test blueprint comes in handy, because you can kind of look at it. But then how do you also make a plan to do all the studying? So I can tell you my plan for OCN, when I took my OCN exam, it was still paper and pencil. It wasn't until the fall. I was working 2 jobs at the time. I worked as a home care nurse, and I worked as a staff nurse in an infusion center. I had my study book with me everywhere I went. So if I was sitting on the beach and I had 20 minutes, I was studying. I did a home care case where I actually traveled to New York with my, I did pediatric vent patients at the time. I traveled with my little girl to New York for a conference. When her family had her, I was sitting out by the brook studying. I was studying in the car. I studied whenever I could. I got with my coworkers, because there was a few of us taking at the same time, we set up study groups, and at lunchtime we studied. So it's just whatever works for you. I can tell you I'm an auditory learner, so I think everybody in my apartment complex learned about oncology nursing as much as I did, because I read it all out loud, but whatever works best for you. When I took my ANCC CNS certification, it was med-surg based. I was an oncology nurse. I had been an oncology nurse all through my career, and now I had to take this generalist certification. And there were things on there about cardiopulmonary, respiratory, neuro, things that I hadn't really studied in 5-7 years since I had been an undergrad. And so I had to look for different ways to study. So study books are great. There are books that are out there for actual certification types. So OCN, advanced practice nurses, but sometimes those nitty gritty pieces of that test content that you don't know where you're going to get, just find that generalist book. I can tell you for my CNS exam, I actually got a med-surg certification book for undergrads, and just studied those pieces that I knew I needed. And then another thing is general test taking resources. Those are great things. Like Kaplan is what I took when I took the NCLEX. They gave you how to look at a test question, and figure out what is needed in the test question, what isn't needed, how to look at those distractors and pick out definitely which ones don't work and which ones do. And we all really write the test similar. So we all write them so that it's not easy for you. There aren't going to be 4 answers and 3 of them are ridiculous and 1 of them is right. They're all very similar. So you really need to understand those test taking skills. There are classes and other study products out there to help you with certification, but I want to warn you about them. Some of them can be very misleading or give fantastical claims saying that everybody will pass when they take this course. Well, I'm going to tell you a little secret. None of them have insider information. You know, Tony said that ethics piece that nurses have to have when you take certification exams. When you sign on to take that exam, it actually states in that signature of acknowledgement that you will not share what the exam questions were, and you will not share the things that you learned about the exam. When we write test questions, we have to sign, again, stating that we're not going to share what we wrote. So there's no insider information. Basically, they're using those test taking skills and those resources that we use to write the test and writing information about it. So that's just something, Tony and I recently have had to deal with a couple companies that say that they're 100% guarantee they're going to pass the OCN. And so we're now talking with those people because that's just not true. When you're looking for study resources, again, look where on the site where you registered. That's the best place to find that information of where you can get it. Look at that source reference list that's used to write the exam. Those are the best things to use. And a lot of the certification organizations have sample test questions and practice questions, practice tests that they approved, so they are written closer to what you're actually going to see on the exam. They won't be questions you see on the exam, but they'll be very close to those questions. All right, test taking. I have test taking anxiety, and I've taken many exams. Pencil and paper was always nerve-wracking for me because when I took the OCN, it was paper and pencil. I take test questions very quickly. I read the question, I answer it. I don't usually go back just because that's every time I go back, I usually change things. So I'm usually that first person that is walking up to the front of the class, handing it in, and that's kind of nerve-wracking. But with computerized, you don't have that, but you still have this anxiety, especially when you're taking certification exam, because I'm already a nurse. I already do this every day. I should know this material. So if I fail, what does it say about how I practice? So it can be very nerve-wracking. Most of the certification tests are computerized. I think there's still a couple out there that are pencil and paper, but most people have gone to computerized because it's easier for the organization to control that test, to control the questions, and control the people that are coming in. The test structure is very typical. It's usually a set number of questions, anywhere from 100 to 300. I don't really know any that are 300 questions, but I think there are some that are out there. There are different types of questions. Most of the questions are either knowledge and comprehensive, and that's that you know. So they may ask you like a typical white blood cell count is, and you just know that number. The most difficult questions to write and the most difficult questions to take are application questions. And in certification exams, you'll see a lot more application than you will knowledge. And what an application question is that you have to know a little bit about a couple different things. So for example, there may be a question asking about how to educate a patient on tube feedings. So you need to know why the patient's on tube feedings, what a tube feeding is, and what the patient may need to know about tube feeding. So that's an application type question. So there's multiple things that you need to know about that patient and that situation to answer the question. Now I can tell you in application-based questions, frequently there's a lot of stuff that's thrown in there that you don't need to know. And that's to really help us understand that you know what we're asking you and you know how to really tease out that information. So just a test taking tip 101, any of that stuff you don't need to know, cross it out or cross it out of your brain. I usually have a piece of paper next to me where I write down the important things. And then when I read the distractor, the question that I'm being asked, I'll cross out those things that I call it garbage. It's not really what it's called, but that's what I call it, that I don't need to know to answer the question. Most of the certification exams that you're going to be taking will be multiple choice. Very rare do you see anything that's essay or short answer because you can't be objective when you answer those. And these tests are really objective based. There may be performance. Again, Tony talked a little bit about that. There's not a lot in nursing that we have performance. As far as certification, you may have that at your job. You may have that with licensure, but not really with certification. The thing to know about certification exams is that a passing score has already been determined. So much like in school where you have to get, I don't know, 90%, I don't know what it is these days, 86, I think it was, or 88 it was when I was in school. But you had to have that grade, and that's that grade you always strove for. That's the same thing with certification exams. There is a passing score that is set the bar. So say it's 80%. If you're 80% or above, you pass. If you're 79.9 or below, you fail. And it's set that way for everyone. Now, the interesting thing I think is that the passing score is a little bit lower than what you would actually think. And I say that because I remember in nursing school, I think it was either 86 or 88% that we had to get on everything. And then I heard what a passing score rate was on one of the exams, and I was like, ooh, that's much lower than I'm used to. But I'm not saying that to say that you can't pass. The goal is that people pass and that we can deem competence at that level. And we have lots of people that are much smarter than I am that sit down and help us figure out how to make sure that that passing score is right. Much like the NCLEX, where the NCLEX has that passing score, but the NCLEX asks you questions. They start at a low level and they ask you higher and higher levels, and the number of higher levels helps deem that competence. We're trying to do that with just a score and not give you that level of questions. I can't say enough that this is not the NCLEX because I hated taking the NCLEX. But the other best part about certification exams, not best part, is at the end of the test, most tests you get to know if you passed or not. Now, when I took the OCN and it was paper and pencil, I had to wait like 2 months, I think, to find out. And that was nerve-wracking. But with all my computerized ones, after I was done, you hit that end button and it tells you whether you're passed or not. And it's kind of nerve-wracking, I have to say, because you sit there and you're like, okay, do I really want to know or don't I want to know? And then you hit that button and then you think, no, I don't want to know. And then you hit the button and there's all these people in here around you that took a test, and some people are taking NCLEX and no one's really taking the same test that you are. At least you don't think they are. And you're like, what's going to happen if I fail? All right, I'm going to hit the button. And then you hit the button and you find out that you passed, and you can't really scream or anything because you're in this room full of people that are taking exams, but you're just like, yes, I still have it. And then you walk out and you get a little paper that says you passed. So, I mean, it's a great feeling, but it's also nerve-wracking. All right, Tony, now you can go to the next slide. All right, you're certified. Yay, you passed. Now what? What do we do now? It's so great. We passed. We celebrate. Celebrate your success. Know that you did a great job. Becoming certified is a huge accomplishment. I remember when I got my OCN exam certification, it was my first certification, how proud I felt of that and how proud I feel of all the certifications that I have. Be proud of those certifications, display your credentials. You saw my name with all my letters. In fact, I had a physician once say to me, Clara, you have more letters than you have in your name. And I'm like, yep. And I worked hard for every single one of them. And I'm very proud of all of them. They're on my badge. They're on my business card. They're in my email signature. My husband and my son are tired of hearing about them. But again, I'm very proud of them and I'm very proud to display them. Use certification to help you with your professional development goals. Again, OCN helped me with that professional development goal for myself. My AOCNS, ACNS-BC, those were required for my job, but they really helped me get to where I needed to be professionally. Now, what they also help me do is help me stay up to date with what's going on in my profession. I have to do continuing education to stay up to date with that. So it helps me with my professional goals. It's helped me with professional goal of being on the board. I'm now the ONCC president-elect of the board of directors. That was one of my professional development goals, and certification helped me get there. So you've passed your exam, you're grateful, you're like, oh, thank God I don't have to take that again. But you still need to make sure that you review those requirements for renewal, because it's important to know what you have to do. For ONCC, our renewal is every 4 years. For my ANCC exam, it's every 5 years. My ANCC exam changes frequently what my requirements are. So about every year, year and a half, I go on to make sure that I know what I need to do for my next renewal period. For example, halfway through one of my renewal periods, they changed and added that I had to have 75 contact hours in pharmacology. I had a few years to get it because luckily I looked and understood that. But it's important to know like how many years you have your certification and what you need to do to renew, because you never want to take the exam again. So whatever you have to do to keep that, you want to make sure that you do. I think that was the last slide. It was. So I hope that we helped you understand certification a little bit. I hope we didn't scare you off from it. But again, we're here to answer any questions that you have. If you have questions about oncology nursing, if you have questions about being an advanced practice nurse, or certification, anything really. Tony, Patrick, and I are here to answer any of your questions.
Thank you so much, Clara and Tony. Just to give a rundown for all of those who joined us a little bit later, Tony had given a really, really wonderful presentation on the significance of certification. And then Clara went on to tell us the general steps of certification, even though it may be different for each type of certification. She gave us her experience as well as the general steps. I'm going to drop in the chat now a Google form for you to complete to get credit. And also, I do want to give a shout out to Carolina. So if you complete the Google form, we will be able to send you a USF face mask, and courtesy of very, very generous ONCC, 2 people will also be chosen to be sent an ONCC swag bag. So make sure you complete that survey. I'm also going to be putting in files in the chat for the PowerPoint, as well as some handouts from Tony and myself. Give me 1 second. And I'll also be emailing this to everyone who came today. So that one is going to be the PowerPoint. And then this next one is a little pamphlet about the difference that certification can make in our careers. And then I'm also going to be dropping 2 books courtesy of ONS, which are Oncology Nursing Scopes and Standards, and also their brand new, the Current Trends in Oncology Nursing book. So I'm just going to drop those in the chat now. And lastly, I'm going to drop this document that I put together. So I looked at a couple different resources for different options that you guys can get potential certification in, just to give you an idea and just to get you thinking, maybe encourage you to look into that area. So I'm going to drop that now, but I'll also share my screen. That way, because there are so many, when we looked it up, there are so many, but this gives you an example in different fields, and hopefully that'll give you some direction for where you might potentially want to get certification in the future. And the list is really exhaustive beyond this, but I just want to go into a couple of them. I'd like to highlight 3 that I bolded: the advanced cardiovascular life support, as well as pediatric advanced life support and the neonatal resuscitation program. For those, you don't need any kind of experience. You can actually obtain those now. For those interested in peds, I highly recommend your PALS or your NRP. So I would look into that if you're interested in peds or maybe maternity. And then for anyone who is interested in going into critical care, or just for anybody, I would recommend looking into the ACLS. But in addition to that, if you're interested in neuro, you can become a stroke certified registered nurse. If you're interested in psych or mental health, you could do psychiatric mental health nursing or certified addictions registered nurse. For those who know Dr. Kadora, he actually has his psychiatric mental health nursing certification. For cardiovascular, you could become a certified heart failure nurse, or again, get your ACLS. Highly recommend that. If you're interested in GI or GU, you could become a certified gastroenterology registered nurse or a certified dialysis nurse. And then for immune hematology oncology, you can become HIV or AIDS certified or blood and marrow transplant certified nurse. That's actually through ONCC, in addition to their slew of other certifications that they offer. For OB and pediatrics, in addition to the PALS and the NRP, I recommend electronic fetal monitoring and neonatal intensive care nursing, if that's the field that you want to go into. For emergency trauma or critical care, there's adult critical care nursing, but they also have it in like adult pediatric neonatal. There's trauma certified registered nurse or certified emergency nurse. For wound care, if you've ever done hospital rotations, you might have come across a wound care nurse. So they're certified ostomy care nurse or certified wound care nurse. It's actually, I know from my clinical experience, it was actually a wound care nurse that had gone around looking at all the wounds, and it wasn't like a doctor, at least for the floor that I was at for that specific hospital. If you're interested in research, you can get certification in research. I know someone had mentioned maybe going to gerontology. You can get your certification in gerontology. I believe Dr. Kadora also has that certification, public health nursing, or if you want to go into OR. And then here are 2 links that you can check out for the full list. So there's the American Board of Nursing Specialties and nurse.org that lists all these credentials. And yeah, I think that's it for this section of the presentation. I do want to hand it off to Heather. Heather, did you want to take care of the Q&A?
Sure.
Thank you.
So if anybody has any more questions, just let me or Michaela know via the chat, or you could send to everybody. That works too. So we do have a couple questions, and so the first one is, what can you do as a student to prepare for certification while you wait to be qualified?
So it's never too early to start studying. And again, looking at what certification you think you're going to want to take and making sure that you understand what those eligibility requirements are. But again, it's never too early to start studying, just looking at it, asking questions, especially if you're a student, and asking your mentors or the nurses that you see that are certified, or other people like, hey, what did you do? How did you study? When should I start taking this? I think it's good to start looking and understanding those pieces.
Great, thank you. Another question is, are there any resources that will give you a grant for certification, or how do you approach your employer to ask if they can cover for the certification?
So a lot of the certified bodies do have scholarships. I know ONS has a scholarship for certification. And then getting to your organization can be hard, but talk to the chief nursing officer, the nursing leadership about what the importance of certification is. Maybe they've seen it or they understand it. There are different programs out there, like ONCC has what's called a free take program, where an organization can join and they pay for the exams. The employee themselves do not do that. So research the organizations where you think you and your colleagues want to take certification and see if there's something similar, and then take that to the nurse leadership. If there's shared governance within your organization, it's also another great way to start working on it. I can tell you our shared governance nurse practice actually did approach our chief nursing officer to get additional monies for people that are certified. So our nurses now get $1 more an hour because they just use their voice together to kind of show why it was important to them.
Yeah, Heather, and I'll jump in on the employer programs like our free take. A number of the organizations have those, but they all have different names. So I would say one of the ways to find out if they have that kind of program that then you can ask your employer about is when you're researching the credential on the certifying body's website, go to the tab for employers. Because if they have an employer program like our free take program, that's where it will be described. And that way it's an easier way to find out if that's available. Because it might be that your employer doesn't have it, but you could be the one that gets them to sign up, right?
Okay, that's really good to know.
Hey, Clara, real quick, I wanted to ask another thing to keep into mind when you're looking at that, not from the grants or scholarships side of things, is that if you're working for a hospital that might be, might have magnet status, a lot of times magnet status comes with, you having to have a certain number of nurses certified within their organization. So if when you're looking for that job, I mean, if they're working towards magnet, or they're looking about their, to be redone again, they're going to probably be more apt to provide you with maybe reimbursements towards your certifications as well. So just kind of keep that in the back of your mind as well. I did find a lot of institutions that were magnet or working towards it were, reimbursing their nurses for going for those certifications.
Oh, that's great. I didn't realize that magnet also had kind of went with certifications as well.
Yeah, that's like one of the requirements. It's one of the
Mhm.
clinical towers that they have within it to achieving magnet status is the
Yeah.
amount of certified nurses within your organization.
Yeah, it's either the number of nurses you have or your goal to get more nurses certified. And so for that goal, a lot of times they will offer payment or incentives if you do take certification.
Oh,
I
so good to
forgot
know.
all about that, Patrick. Thank you.
Yep, you're welcome.
Great, thanks. So we do have another question. So what happens if you fail, and how many times can you take the tests?
It all depends on the certifying body. Usually it's a few. And sometimes you have to wait a certain amount of time in between each time you take it. So again, it all depends. And that's why you want to read up on everything before you take it. Example, like our free take program, failure is a huge barrier for a lot of people taking these certification exams, right? No one wants to fail at anything if you're a bad test taker. So what ONCC did with the free take program is you actually get 2 chances to take that exam at the cost of 1 test. Again, it's the organization that's paying for it, but it takes that fear of failure out of it, because if you fail, you still have another chance to take it. I can tell you a lot of the staff that don't take it is because of that fear of failure, and they don't want to fail that exam. But even like the NCLEX, if you fail it, no fear, you can take it again. You have to pay more money, of course, because everybody likes their money, but you can take it again. And you can take it multiple times. You just have to usually wait in between. So there may be, I don't remember how many weeks it is. I think it's like 6 weeks the first time. And then if you fail it again, it's like 8 to 10 weeks. And so again, just look at the actual certification you want and what their requirements are. It's all in that test candidate booklet. Usually all of that has all that information about what it is to take it. And then if you fail, what the stipulations are.
Okay, that's
And one of
awesome.
the other things that can be helpful is that according to those accreditation standards, you know, the things that Clara has talked about, like the kind of information that we have to make available and that we do make available in the candidate manual and on our website, those things are all required by the accreditation standards. And that's how we can speak pretty confidently that you will find that same kind of information on all of the programs that you might be researching, right? And one of the other things that we provide by accreditation standard is the pass-fail rates and the number of certified nurses for each accredited program. That should be on the website for each of the organizations. And sometimes that can give you a little bit of confidence to see, you know, to know what the pass rate is, right? So.
Great, thank you so much. So looks like we're right at time, and those were the questions that we all had for you tonight. Carolina, did you want to say anything before we close it out?
Thank you, Heather. I just want to really recognize Clara, Tony, Patrick, the GNA. This has been an amazing presentation, and I think that our students are thinking about their careers, and this has been really essential and key to start thinking about, how do I build my career? Where do I go? So I am very happy that we did this event and that we recorded it, because it's those that you want to listen to it in 3 months. You want to revisit whenever you're going like, wait, what did they say? So thank you really a lot for making yourselves available, for helping us help our students really build their career and their path. And also GNA, you've been fantastic. Heather, Michaela, I couldn't ask for better partners. Your organization skills, your dedication, your passion for the profession, but also as a student, it's really recognizable. So thank you very much to all. Thank you for the students that even at the end of your semester, in the middle of turning papers in and getting ready for exams, you're here. So we really appreciate your participation. And with that, Heather and Michaela, if you guys want to close.
Yes, I just wanted to personally really thank Clara and Tony and also Patrick and Carolina for organizing this. But I know I speak for a lot of my peers when I say that a lot of us are very anxious about going into the field. One, because of COVID, and there are all these rumors about, having a hard time getting hired. And then a lot of us missed out on our clinical experiences because the hospitals were closed. So whatever we can do to further enrich our educational experience and our chances out in the job market, we really, really appreciate. So it was such an inspiring, uplifting, very motivating presentation from you two. Thank you so much.
You can come to Michigan. We have lots of jobs.
Thanks for having us. I so respect the work that y'all do and the work that I know that you're all going to do when you get out into the field. So thanks for having us.
Yeah, I just want to thank you all for letting us be part of this wonderful series of presentations that have happened over the last few months, whether it's on self-care or whether it's on advocacy and certification. Like I said, we are really thrilled to have formed this wonderful relationship with the University of San Francisco. And it's just been wonderful to work with Michaela, to Heather and Carolina. So I just, again, thank you for including us in this and letting us meet you all and work with you. And I look forward to working with you, hopefully more in the future.
Yeah, we'll see each other in the fall semester now.
Yeah, that sounds good to me.
Thank you, everyone. Good luck on your finals. I know that's what you guys are all coming up to, and good luck in your career. And again, if anybody wants to reach out to me and ask any questions, my email is beaverc@karmanos.org. I can throw it in the chat. Michaela and Heather and Carolina have it. So if you guys need to get a hold of me, please feel free to reach out. I will answer any questions you guys have.
That obviously goes for me as well. Feel free to reach out to me if you join ONS or you want to, and you want to maybe meet a nurse that's more local instead of us East Coasters over here. I'd be happy to introduce you to some of our members that are in the Bay Area there.
Thank you. Have a wonderful evening, everyone.
Thank you all.
Thank you.
Good night.
Good night, everybody.